Should I go for FUE or ACell plus PRP?
FUE surgery or follicular unit extraction transplants are very popular around the world. FUE surgery grew in popularity partly because of the backlash against the visible scars of patients associated with FUT or strip surgery. Due to in large part our success with Tricostem hair regeneration system, consumers have more options besides surgery to treat hair loss. So how do you make a decision on whether to have FUE surgery or a non-surgical treatment such as ACell plus PRP? As both a hair transplant surgeon and the inventor of the Tricostem hair regeneration system, I'll discuss how I help my patients make the best choice for their individual situation. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. As I stated earlier, I've been performing hair transplant surgery for a large part of my career. Based on the wound healing technology we used to help patients after hair transplant surgery, I developed the Tricostem hair regeneration system, which since 2011 has been a highly successful, standalone, non-surgical hair loss solution for men and women who have come to us from around the world. The world of hair loss treatment can be described in a way as a bit of a free-for-all. There are limited barriers to entry for anyone who wants to offer non-surgical or surgical hair loss treatment. It's well known that many medical retailers are offering non-surgical hair treatments like PRP alone or ACell plus PRP, and these people have no previous hair restoration experience. The practice of hair transplant surgery also requires no standardization through any formal residency or fellowship training. This means that many practitioners are putting their own financial interests ahead of the best interest of the patient. This notwithstanding, I think it's important to understand some of the details of how I came to developing a non-surgical hair loss solution in the context of my having done hair transplant surgery for decades. As mentioned earlier, Tricostem hair regeneration treatment evolved after I was using extracellular matrix by ACell on the scalp to better improve graft survival as well as improve the healing of the donor area. I was surprised to see that about a year after surgery that native hair that wasn't transplanted increased in density and grew in thicker. Upon making this observation, I decided to see if I could create a system to help people have better scalp coverage with their existing hair without surgery. After working for several years and overcoming numerous obstacles, I succeeded in creating a way to customize hair loss treatments specific to a classification system I developed and help men and women of all ages who suffer from hair loss. People came from around the world, and we became so successful that I built a freestanding center called Tricostem Hair Regeneration Center in Tysons Corner, Vienna, in Virginia. Now, this was not exactly welcomed by hair transplant surgeons, and at the other end of the spectrum, we inspired companies to create generic PRP and ACell plus PRP treatments, both of which require multiple visits per year with no clear long-term plan. In addition to helping men and women with genetic pattern hair loss, we have also been able to help people who have had previous hair transplant surgery. We actually help a lot of people who have had FUE surgery improve their graft survival and results by treating them soon after they undergo their surgery. In addition, we've learned that in spite of the assumption that hair grafts can, quote, last forever, that even hair transplants don't continue to grow as well as they once did as you grow older. I've helped many people who have had hair transplants done in the decades past get more coverage from those hair transplants after our treatment. Regardless of technique, hair transplant surgery is limited by the number of hairs available from the donor area and the limited density that can be achieved with surgery. Surgical hair transplant is essentially limited to no more than 20 hairs per square centimeter. Natural hair density is much higher and can be over 100 hairs per square centimeter. This means that even if hair is thinning, your natural hair density is greater than any hair transplant could possibly achieve. Now, it's no secret that FUE surgery is fraught with problems, with outcomes such as very low graft survival, particularly in comparison to FUT surgery. Another significant issue that is generally not discussed by hair transplant salespeople is that during the course of a hair transplant operation, a lot of your existing hair can be damaged and lost permanently. This is referred to in the industry as collateral loss. So if you undergo hair transplantation in areas where hair is present but thinning, you can actually end up looking worse than you did before surgery. So if thinning hair can be saved and thickened, non-surgical treatments can potentially achieve better density and overall scalp coverage than an extensive hair transplant. Trichostem hair regeneration works by thickening thinning hair and stimulating the growth of dormant hair follicles that are still viable. So in the right candidate, our Trichostem hair regeneration treatment can achieve more scalp coverage than even 2 hair transplant surgical procedures. Now, does this mean that there's no point to hair transplant surgery? No. If you're smooth bald in the front of your scalp, then a hair transplant will allow you to have hair where hair is no longer present. Ultimately, it's important to think strategically about how to best manage your hair loss. For years, I've seen patients who impulsively or desperately underwent hair transplant surgery and later regretted their decision, particularly as their hair loss progressed, and they underwent additional transplantation, which always failed to keep up with their ongoing loss. The take-home message here is that hair loss needs to be managed, and a long-term view should be taken before you undergo any procedure. With this in mind, I provide my patients with a treatment plan. Trichostem hair regeneration is a customized formulation system based on your age, gender, age of onset of hair loss, degree of hair loss, and other treatments, as well as the medications you're currently on. Having put our ACell plus PRP treatment on the map since 2011, other treatments have sprouted up claiming to have ACell and PRP and have proliferated tremendously. Our protocols typically consist of only 1 or 2 treatments, with the second treatment being done 15 to 24 months after the first. The generic ACell plus PRP treatments require multiple treatments in the first year and with an ongoing maintenance treatment for as long as you're willing to pay. They kind of hook you with a supposedly low cost and then keep charging you for every treatment. Simply said, this just adds up. My approach with Trichostem hair regeneration is that the cost is for a comprehensive treatment plan, including the typical 1 to 2 injections during the 2 years you're being taken care of with us. You have regular follow-ups every 3 to 6 months in our offices or virtually as needed in order for us to monitor your response to our treatment plan. This is why we're so accountable to our patients. In my experience, most people who seek consultation for hair transplant surgery are not bald, but rather are experiencing hair thinning. Typically, they seek professional care after they've reached a certain threshold of hair loss and are very motivated to take action. Objectively, it makes sense to try and maximize scalp coverage with your own hair that's already present before undergoing surgery to place hair where none exists. Most people I consult with see the logic of this strategy and undergo Tricostem hair regeneration first before pursuing hair transplant surgery. Tricostem hair regeneration patients will typically get much better coverage with their existing hair being regenerated in comparison to undergoing FUE surgery. So when considering a hair loss treatment, it's important to take the most strategic approach to maximize your scalp coverage for the longest time. The success of our Tricostem hair regeneration system is evidence that a non-surgical treatment can have significant advantages in both cost, effectiveness, and longevity in comparison to FUE or any other hair transplant surgery in, of course, the right candidates. I hope you found this information helpful. Thank you for your question.